Yeah.
Okay, and we are now recording.
All right.
And hello, everyone. My name is Samsara Morgan. I'm the Executive Director of the Oakland Better Birth Foundation. I'm a birth and postpartum doula. And I'm here with one of my wonderful clients, Brittny.
Hi, everyone.
And she's going to introduce herself to you in a second. I had the honor of being one of her doulas last year when she had a beautiful set of twins.
Yes.
So I'm going to let you introduce yourself. And do you want to start out telling your birth story?
Sure. Well, my name is Brittny Anya. I live in Oakland, California. I'm originally from Southern California, Los Angeles. I moved up into the Bay Area in 2014, so I've been here for a while. And last year, I had a set of beautiful twins that changed my life forever. Boy-girl twins. And yes.
What are their names?
Oh, Chisam and Chidera.
So beautiful. Do you mind sharing what their names mean?
Yes. So Chisam means God's destiny, and Chidera means God is with me. And they are Nigerian Igbo names.
Beautiful. Beautiful.
Yes. Thank you.
You want to talk about the day their process of coming here to be with us?
Yeah. So when you say birth story, like, are you talking about like the whole like labor story?
That's really interesting. That's interesting that you say that because there's so much that could be part of that story. It could be like we could start out with, okay, you can share how you found out you were having twins.
Okay, so we can start from there.
Yeah, and then
Okay. Got it. Okay. So in fall 2019, I found out I was having twins. I was really excited to get pregnant because me and my husband were really trying. And so I think it was around September when I found out I was pregnant. So excited. And then maybe like a few weeks later, I had got my first like ultrasound appointment. And so the story is really interesting. Well, funny, I mean, because in the ultrasound appointment, the nurse was basically like, oh, I hear 2 heartbeats. And I was just looking so confused, like, what? What does that mean? And then she was just like, oh, there's 2 placentas. And I'm just still so confused. It didn't hit me that that meant twins. And she was just like, oh, you're having twins. And I just broke out in tears. Like, I was just so overwhelmed. And to be honest, I wasn't very happy about it. Just to be honest, because I mean, just knowing that you're having twins, I mean, that's a lot to take in. And so the nurse, like, she literally grabbed me and she was trying to console me because I was just crying. Like, I was not expecting to hear that. I don't have twins in my family. So that was just something that was really out the ballpark for me. And then my husband was in the corner just, oh, yeah, we're having twins. And I'm looking at him like, do you know what that means for us? So yeah, that's how it started off, man. Yeah. So that's how it started off. And then, I mean, after a few days, I mean, after letting the information like set in that I was having twins, I started to feel better about it and just feeling like more just confident and like happy, that I, was pregnant and that I have 2 babies inside of me. And so, yeah, I told all of my friends and family, everybody was really surprised, like twins. And then we actually we waited to find out the gender of both of the babies until they were born. So we just kept it a secret. Like, we didn't know. We told the doctors and everybody not to let us know. And so, yeah. And so I would say, like, during my pregnancy, like, I was told that I was a high risk pregnancy. And so, yeah, just carrying that information with me that I was high risk solely because I was carrying twins, like that was a level of anxiety for me because just knowing that I'm high risk, it was just like, wait, what? So there could be complications, and just having that always in the back of my mind, that was,
Yeah.
I mean, it didn't like overshadow like my whole pregnancy, but it was a little bit of anxiety like in the back of my mind, like carrying that
Sure.
with me all the way throughout the end of my pregnancy. um yeah, and so the whole pregnancy like went okay. Like I didn't even throw up, like not once. Like
Mhm.
I felt fine. I would say maybe up until about 7 or 8 months, like that's when I really started feeling fatigue, just really delayed, just lagging everywhere because of course my belly was getting really big. And
Yeah.
so yeah, yeah, I would say probably up until about 7, 8 months, like that's when I really started feeling like, oh, I'm pregnant. um yeah, so so I went into labor. Let's see, the twins are born on the 26th and I went into labor on the 24th, I believe.
Mhm.
And so the day went, like I remember coming back from Chipotle. I had just gotten my burrito bowl. I was sitting down, I took a bite, and then I stood up, and like I just remember seeing like or feeling like a gush of water coming down. And I was just like, wait a minute, did my water just break? I was just so confused. I was like, did my water break or did I pee on myself? And so after just letting that sit in for like a few minutes, I was like, oh, I think my water broke. And so I called my husband who like wasn't home at the time. And so I was like, babe, like I think my water broke. Like you should hurry up and come back, but like don't rush too much. So he came
Right.
back. And so by the time he came back, like I think, oh no, before he came back, like I had called Kaiser to let them know that my water broke. And then I think I had also texted you
Hmm.
that my water broke too. And so you were telling me to like, just wait until your contractions are a little bit closer. And then halfway through the night, I had started like throwing up crazy. And like I didn't know that like that was common for women to throw up during pregnancy. So I really started to freak out. And so that's when we called Kaiser to see, like if I could just come in. And so they were ended up like Kaiser ended up being like full. I think they said that like all of their beds are full at the San Leandro Kaiser, which is closer to my home, which is maybe like about 5 minutes away. So we drove out 30 minutes all the way to Walnut Creek. And then like they were trying to get me to stay. And I was just like, no, I just want to make sure like I was okay. I don't want to stay right now. Like I would rather, come back like once my contractions get a little bit closer. And
Hmm.
so they were really trying to get me to stay, and like they even had me sign this sort of contract to like let me go, saying that like they wouldn't be liable. And I was like, okay,
Right.
whatever.
You're leaving
Like
against doctors or against doctors' recommendation.
right, yeah. So I was just like, I don't care, like I don't want to be here waiting all this time until my contractions get closer. So we ended up leaving Walnut Creek, came back home. I was still just throwing up like crazy. And so I think once my contractions started getting a little bit closer, like that's when we called Kaiser and San Leandro, which is closer to my home again. And
Hmm.
so they were saying that I could come in. So like we went in, and yeah, that's when they checked me in. And so I think you and Brittny came the next morning, like bright and early in the morning,
Hmm.
and you guys were there. And like I remember still feeling okay, like I was throwing up and still feeling like a little bit okay. And then when the doctor came in, can I mention his name? Is that
Please
okay? Or
do. Oh,
okay.
please do. It's your story.
Okay, so his name was Dr. Matthew Naakola, who was very rude to me, my husband, my doulas. Like he sort of turned the whole experience for me kind of like upside down because once my contractions started getting a little bit closer, they were saying because one of my babies was transverse that couldn't have a vaginal delivery and that I would have to have like a C-section. And so I remember in my birth plan, I was like, I had put that I had really wanted to have like a vaginal delivery along with these other holistic type of things. And so Dr. Nikolai was just very rude, just nasty to me and everybody in the room because after he told me that I needed to have a C-section, like I had pushed back and I was just like, I want to have my babies vaginally. He was just like, well, we can't do that, because of because of X, Y, and Z, because of your baby being transverse, like across my stomach. And so, sorry, I'm losing my train of thought here a
It's
little
okay.
bit. Yeah,
Also,
yeah,
he wanted you on an epidural, as I recall. He really
yes,
wanted you to take an epidural.
yeah, to induce my labor really fast to get me dilated. Yep, yep, I remember that part. And so I remember pushing back on that too, also saying, like I want to wait until the babies are ready to come, basically. And so, because I was pushing back on, not having the C-section and not taking the epidural like right away, he was just very rude and like talking over us. I remember at one point,
He was
I
yelling.
was, yeah, yeah, yep, definitely yelling. And so I remember when I was having contractions, I had told one of the nurses, because there was a lot of people like in and out of the room. And so I had told one of the nurses, can you pause everybody from coming like inside the room right now? Because I'm having a lot of contractions. I'm feeling like incoherent. Like I just need time to relax because it was a lot going on. People in and out of the room, so many questions while I'm in labor.
And your labor
I
was
just,
making good progress. You were having a strong labor with all these people coming at you.
oh yeah, yep, yeah. And so after I told the nurse that, I wanted maybe like 10, 15 minutes later, Dr. Nicola came in the room telling me what I needed to do. And I didn't even say anything to him. Like I just let him talk. And like I remember him talking and then he tried to wait for a response. And then I didn't give him anything. And like I don't remember anybody else in the room saying anything either. And so he just left after he realized that he wasn't going to get any response out of me. Um, and so I remember telling the nurse when the nurse came back in, I don't want him to deliver my babies. Like he's rude, he's being dismissive. I don't know if he thought that because, I'm a young Black woman. He thought that, maybe I didn't know anything. He could just tell me what to do with my body. It was almost as if I didn't have any other, like, the way he spoke to me was that I didn't have any other alternative options. It was just, you must do these things. And then like I remember him also saying, oh, because I think like at one point during labor, like I had got like preeclampsia, or I think they call it postclampsia or something.
Preeclampsia. That
Uh-huh.
you had you had high blood pressures during your labor? I'm trying to remember that.
Yeah, yeah, yeah. So
So
like after all of that commotion,
because you
that's when
were
my blood pressure.
after you were upset and your blood pressure spiked. And then
Mm-hmm.
he was saying you needed an epidural because you are an African American woman and you're
Mm-hmm.
prone to preeclampsia. But you had
Yep, yep, that's what happened.
but you had a blood pressure spike because he was being rude to you and you were upset.
Yep, yep. He was being rude to me. I was upset. And yes, so he tried to use the whole preeclampsia thing. And they said that I had protein in my urine. It was like, okay, like even if I, do have preeclampsia, it's still my choice around
It is.
my body. And so just going, back and forth with all of those issues. I remember telling the nurse, I don't want him to deliver my babies. Like, is there anyone else? And like, I remember her saying, oh, he's like the head doctor of like this department. I was just like, well, I don't want him in the room. I don't want to talk to him ever again. He's ruining this experience for me, basically. And so I remember there was another doctor that came in, and I feel so bad because I can't remember his name because he was really nice.
Yeah.
Yeah. I don't remember his name. Dang. Okay. Well, I remember him like just like being like very open, like listening and like wanting to know, like what my needs were. And so I was still in labor during his whole shift. Like, I wasn't dilated enough to deliver. So I remember like once he left, then there was another doctor who came in, and dang, I don't remember her name either. Bad with names. But I remember she also being like very nice, and she was just like, you know what, I can, deliver the babies vaginally for you because she's had experience delivering like transverse um births. And so yeah, I remember on yeah on that Sunday on the 26th, around, what was it, around 6 a.m., that's when I was ready to deliver these babies.
Centimeters. Yep.
And then I got hit with another sad news that my doulas could not be in the room with me, just in case if something happened, like they needed me to be in a surgery room.
The twins are delivered in the operating room.
Yeah, in the operating room. And so I was just like, why couldn't they have told me that ahead of time? Like, you guys see my birth plan. You see that I have my doulas in here. And like, nobody really asked me, about my birth plan or things that they couldn't do for me. It was just as if my birth plan didn't exist. It was, yeah, it was,
We had to keep advocating for it. We really did.
yes.
Like you're recommending things that the family is not wanting. So you have to be gentle, kind, and considerate and explaining why things that the family might wanted are
Right.
not possible. And you have to have a good reason to change
Yeah.
the birth plan.
Yep. And not trying to do it out of fear, because everything was about fear. It's like, if you don't do this, then this will happen to you because you have preeclampsia, then you can have seizures and blood clots. And, like they were trying to force their way on me through like fear by trying to instill fear in me, oh, something's bad going to happen,
Mhm.
without introducing any other alternative options. Um, so yeah, that was the downside to that, like not having my birth plan acknowledged. um, However, Sunday rolled around. It was time to deliver those babies. Me and my husband, we went into the operating room, and I had a baby boy, baby A, who they called like the whole time during pregnancy, Chisum.
Mhm.
He came out, and then 2 minutes later, that's when my baby girl, Chidera, came out. Yeah,
Yay! And what did they
yeah.
weigh?
17. I'm sorry. No, no, no. Um. Oh wow, I feel horrible for forgetting this.
No worries. No worries. Take care.
They were both okay. So Chisum was, I think, 5 pounds 9 ounces, and Chidera was 5 pounds 7 ounces.
Those are nice big twins.
Yeah.
That's gorgeous. Two
Yeah.
full-term size babies. And
Yes.
in relation to their due date, were they early? And
Oh,
how?
they were definitely early. Oh yeah, I had missed that part. So I went into labor when I had them at 37 weeks and 7 days.
37 weeks.
And
Okay,
7 days.
37 weeks and
7 days.
okay, so almost 38 weeks.
Almost 38 weeks, yeah.
Okay. Hey, that's within full term land for singletons.
Yeah, yeah. That's what they were telling me is that, I was that like I should look forward to having the babies around 38 weeks. And so it came right at 37 weeks and 7 days.
There you go. There you go.
Yeah.
And they're
Yeah.
nice size and they're adorable.
Yes. Yeah. And I had two little babies, and they could fit right in my little forearm here, both of them.
And you got your vaginal birth.
And I got my vaginal birth. Yes. That was out of my whole birth plan, I would say that was the most important thing for me is to have them vaginally
Mm-hmm.
because like I wanted just like a natural, birth.
Natural.
Yeah, natural as possible. And then also I didn't want a C-section because I didn't want to risk just having to bend over all the time
And taking care of two
after
infants.
and taking care of two babies. That was that was
Was any of the babies breech?
At one point during my pregnancy, I think they were both breech.
During the delivery. So then
Oh,
when you were
oh.
delivering them, did
Mhm.
everybody resolve head down? Or did your transverse baby, that was baby B, that was transverse?
Yeah. So like she was breached.
She was breech? Okay.
Yeah.
So the doctor delivered delivered that breech baby for you. Or you
Yeah.
delivered the breech baby. What am I talking about?
Yeah.
You delivered the breech baby, and the doctor assisted the process.
Yeah. So like what she did was that she went inside me and she twisted her around and then pulled her out.
So she changed the baby's position.
Yeah.
And put the baby made the baby present head first.
Right.
And you pushed the baby out.
Yeah.
Okay.
Yep.
Okay.
Yeah.
Okay.
Yeah.
Yay.
So that's my birth story. Yep, and here we are 1 year later. Now they're
1 year later
running around the house, climbing on the couches, walking.
Oh my gosh. The happy chaos.
Right. Happy chaos. That's the perfect description what's happening right now.
Well, I shared with you that I'm a mom of twins myself.
Yeah. Yep. I remember that.
And my twins are 40 years old. So I look back fondly on the days they don't jump on the furniture anymore.
Right.
So share with me and share with whoever sees this video, what made you want to have a doula?
I would say what made me want to have a doula? Well, first, I didn't even know like what a doula was. Like one of my friends, like she recommended a doula to me. She was like, "Oh, you should have a doula. A doula is somebody who supports you, during your pregnancy." I was like, "What? I've never heard of a doula before." And so I went online and started searching, and I was like, "Wow, I would really want to have this because you get someone who is dedicated to supporting you throughout your whole pregnancy." And like that was why I wanted to have a doula, just to have someone there to emotionally support me, but also provide education as far as like what to expect, because I was just so confused during my appointments with the doctor when I would do the ultrasound. Nobody really explained to me, like what to expect during labor. Are like really, I mean, they did like explain some things to me, but I felt like I wasn't getting like the full picture of like what the full or what my full experience would be like. And so I thought that I would seek a doula, someone who is someone who is dedicated to supporting me throughout my pregnancy. So that was my reason.
Did you find the childbirth education sessions helpful?
Yes, I definitely found them very helpful because in the beginning, like I remember just being like really scared because it was just like, this is my first pregnancy, never had any other children. The only thing I know about birth is that it really hurts. You're going to be in a lot of pain. And so honestly, like that part scared the crap out of me. It was like, I'm scared to be in all of that pain. And so just having you there to educate me on just like what the experience is like. It's like it's bigger than just being in pain. I mean, this is a whole experience about bringing, life into the world.
Mm-hmm.
Um, so you definitely like broaden my perspective and my thoughts just around like childbirth. And so, yeah, thank you for that through all of, the educational moments about what to expect, hearing other women's stories, all of the videos and the discussions. It was very educational and informative because it broadened my perspective on like what childbirth was. Like, it's not just about being in pain and then boom, like a baby comes out. It's like, no, it's a whole because like that was my thought process. It was like, oh, you're in pain and the baby comes out, boom, but
Basically, that's what our culture gives us,
yeah, because every time you see a movie, it's pain and then the baby. Yeah.
Did the experience of being in labor or talking about pain, was it what you expected it to be? Was it that worse than you thought it was going to be? Was it not as bad as you thought it was going to be? What was that experience of laboring for you?
I would say my experience for laboring, it wasn't that bad as I thought it was going to be, as far as like feeling all of the feelings, the emotion, the pain, because I was just so focused on trying to get two healthy babies into this world. I didn't even, yeah, have any like just negative experiences around, ooh, this is scary. I mean, yes, it was definitely scary, but yeah, just the thought of, just bringing two wonderful babies into the world, like it overshadowed all of the scary thoughts. Yeah,
Because
so it wasn't that bad.
that's good. So you
Yeah.
were feeling within yourself that, like, silly doctors notwithstanding, you were dealing with the situation. Like, if you had had no negativity, you would have just gone on and had your.
Yeah, I think so. Yeah, yeah, because I was doing really good up until I had that negative interaction. Yeah, yeah. Like I remember everything going really well. The nurses kept saying, oh, you were dilating right at the right time.
So you were.
No high blood pressure. Yeah, everything was fine.
Cool. So
Yeah.
what would you like? Would you recommend for other women to have a doula?
Oh yes, yes. I would definitely recommend for other women to have doulas. Number one, because our society is set up in a way where everybody is so busy. I mean, my mom would have loved to be there for me every second and moment like of my pregnancy, but she had to work and she's the primary guardian for my niece and nephew. And so she wasn't able to be there a lot of the times. And so because our culture is so set up around, just the busyness of everything, having a doula there to just having someone who is dedicated to support you throughout your whole pregnancy, I would say is priceless. It's invaluable. Um, yeah, like it was everything having you guys there. Like knowing that like I could have someone, to just express all of my questions, thoughts, concerns. It's like, yes, I can like do that like with my husband too, but he's not a woman. He doesn't really have experience with childbirth. Yeah, so just having you and Mika and Brittny, there to support me was everything to me.
Well, it definitely was a tremendous honor for all of us to
Mhm.
be there with you. It's a tremendous honor for me to be there. And I'm wondering how you felt things would have went, say, if you hadn't had a doula and that stuff flew off with the doctor. How do you think that might have affected you? It's just a guess, but what do you think?
Yeah. I think going back to my mindset and my perspective prior to meeting you all, um, I think in the past, it was just like, well, whatever the doctors say, because they are the doctors, they are the professionals. I probably just would have went ahead with it because I probably would have been thinking that they were making the best decision for me, not knowing that I can fully advocate for myself, and like I can challenge the doctor's opinions and perspectives on me and what I should be doing, like with my body. I think I probably just would have went ahead with the, epidural and everything else that like they like recommended for me, like without, questioning, because my mindset prior to that was, okay, well, they are the professionals and they know best and they've gone to school and they've studied this. So why would they, steer me in the wrong direction? Yeah, because when you don't know much about, all the medical terms and jargon, you can sort of get lost in everything and just be like, okay, well, you guys are the professionals and you've done this before. So,
And just this whole piece about being yelled at.
yes,
Even if it was the right thing, who's going to respond positively to being yelled at?
nobody. Nobody.
If it was the right thing, you could have someone shut down and fight you back on something that you might have needed.
Right. Yeah.
Right? And then to shout at somebody and have them just acquiesce because you broke them, how is that good medical care?
No, it's not. Like, it's not good bedside care. It's dismissive. Honestly, it felt racist because I felt like, if I was a white woman, like, would have spoken to me in that way? Probably not, because he was a white male doctor. And yeah, just like his tone and everything, because he was nice up until the point when I started to challenge him and like ask about other alternatives.
Yeah.
Like, he was nice up until that point, but when I started to say, no, I don't want that, that's when he became ugly and just rude and dismissive.
Yeah, it's just, yeah. I mean,
And all I was doing was just asking questions and just advocating for myself and saying, no, I don't, because it's not
calmly
like,
explain,
mm-hmm,
calmly break it down. Because I do recall and I'm sad that I don't remember the nice lady doctor's name too, who ended up
yeah,
delivering the babies.
yeah,
She explained that she wanted you to be on an epidural in case you needed to do that maneuver for baby B. And she
right,
explained it. And she
mm-hmm,
said, okay, I hear that you don't want to have an epidural,
mm-hmm.
and this is a maneuver that I might need to use. And so it will be easier for me to do this maneuver if you are on an epidural. And
Exactly,
she
which,
still gave you the opportunity. Do you agree? She still asked you,
mm-hmm,
would
yep,
you agree?
yep,
And so you agreed.
yep, yep. And explaining that to me made so much more sense. Okay, like, okay, yes, that makes sense.
Right.
Rather than having someone say, oh, this is what you need to be doing, or else something bad will happen to you, trying to instill fear in me.
Oh,
And
because you are an African American woman.
yeah.
What?
Yeah. Oh, yeah, that's right. I had a light bulb. So I remember him saying something to the sense like, yeah, because you are African American, like you guys have high blood pressure and
Because you're
other.
African American, you are prone to high blood pressure, so you
Mhm.
must have an epidural.
Yep, that's exactly what he said.
Maybe white men yelling at me will,
Give me high blood pressure.
Lord.
Yeah.
I'm like, oh, we were so glad when his shift was over.
Yes. And can I also add that,
Anything you
you
want.
know, I had actually filed a grievance like with Kaiser, like on him.
Mm-hmm.
And so Kaiser ended up sending me this letter back to my home that someone would call me to talk with me about, my experience. Nobody called.
Wow.
Months went by and I was just like, I remember filling out that grievance form and nobody has reached back out to me from Kaiser. I was like, let me follow up with them. So I followed back up with them And then they sent me another letter saying that they will handle it, like, I'm paraphrasing, that they would handle it like internally, and they really can't tell me the outcomes because of privacy issues. And I was just like,
He refused to call.
oh, okay. That's what it was.
That's
Okay.
my guess. I
Mm-hmm.
could be completely wrong, but my gut just said that.
Yeah. Yeah. Probably so. Because like I
You have
remember
to be
after,
humble to do that, you know. You got to be
yes, he
humble.
was not humble.
You're not.
Not at all. No humility.
So what was so you don't get to know the
I
outcome?
don't get to know the outcome. Nothing. It was as if, again, I didn't matter. My concerns didn't matter. I mean, something bad happened to me while I was in Kaiser care, and I can't even, or they can't even give me the decency to say, hey, this is an update.
Or have a
Nothing.
customer relations person call you and apologize
Yes.
for your bad experience. The
Yes.
very
Yes, that
least.
would have,
If
yes, the very
he
least.
won't do it, there's
Yeah.
somebody from customer relations saying, "Oh, I hear you had a bad experience. We're so sorry."
Some sort of acknowledgement that, something happened to me that, I didn't
Well,
like or agree with.
I'm sorry that it is resolved in that way because that's not really a resolution.
No.
But I'm really proud of you for writing that letter.
Thank you.
And I'm really proud of you for following through because that does go in the doctor's file.
Good. Good.
That complaint, it's there.
Yeah.
And if you start to get too many complaints after a while, that will have an impact.
Yeah.
And if everybody had bad experiences or good experiences, like we want to be, I'm smack myself that I didn't remember the names of the doctors who did good.
Mm-hmm.
But after we go through their system that we pay for, you pay premiums, right?
Yep. I
So
sure do.
and they ain't small.
No, it's not. I'm still paying on that bill.
Exactly. So then, you sit down and, after you had your 40 days of resting up after giving birth, you write your complaints and you write your acknowledgments and thanks. Thank you to this nurse. Thank you to this doc, so that they get encouraged to keep doing good care. And eventually, if somebody keeps getting too many complaints, that is going to affect their raises, bonuses, all kinds of things.
Good.
So,
I mean, because you got to be accountable for when you do those things to people.
And you're going into a line of medicine that ought to be, of course, it takes skill, but it should take a lot of heart. It should take more heart than anything.
Exactly.
And you're talking to a frightened woman, got 2 babies inside of her.
First pregnancy.
First pregnancy, first labor.
Yeah. But probably didn't care, I'm just another patient in the queue.
Who's not listening. Who's not doing what she's
told. Not doing what she's told. Crazy. Yeah. But overall, I had 2 beautiful, healthy babies, and I am so happy.
And so blessed.
So blessed, yes. Even though they drive me crazy sometimes, but that's what you get.
For. That's what
Yep. Yes, but they also make me very happy.
Definitely.
Yes.
How are you and the babies doing during these COVID days?
Honestly, I feel like I've been quarantined with them since I gave birth anyway.
We've been quarantined.
Because it's just like, where am I going to go with 2 babies? Because if Collins isn't coming anywhere with me, it's like I can't really go anywhere because number one, it's logistically, mentally, and emotionally challenging to just
like packing for a vacation, huh?
Yes. Every time I go out the house, I got this big old diaper bag, I got this big old double stroller. It's hard for me to maneuver. It's just like, so we've just been chilling in the house and we have visitors come by. Thankfully, like my job, mostly let me work from home during the first few months after I returned back to work. So yeah, like I mean, yeah, I've been mostly feeling like I've been quarantined with them this whole time. However, I was looking forward to this moment. Like once they became a little bit bigger, we can go outside and go to the park. And like now it's just like,
Yeah.
dang, we can't even do that. But yeah, I'm thankful that we are all healthy and we are all safe. Yes, that's what's the most important. And
That is the most
and
important.
they have their whole lives to go outside.
That is true. And it
Yeah.
just gets so much easier. We can just hold on to two little hands and all three of you can go walking together.
Right. Rather than the car seats, the strollers, and everything else.
Well, and how have recent events, we are talking today, today was George Floyd's private funeral for his
Yes.
family. How has that event affected your beautiful African and African American home?
Yeah. I mean, obviously, it's personal because I'm Black, my husband's Black, African. My kids are Black, I have a son, and just everything has been so just overwhelming with all of this. And it's just like, again, really? And now that I have kids, it's starting to hit home a little bit harder because it's just like, what kind of world am I going to be raising my kids into? I mean, I don't try to think too hard about it. And I try to limit my time on social media, watching news, because it can be all pretty overwhelming.
Massively so.
I mean, before this, just with the whole COVID-19 and then finding out that Black people are being impacted the most. And then on top of this, George Floyd, Breonna Taylor. I mean, everybody.
Yeah, yeah, yeah.
Yeah.
I
Yeah.
think
So
if I,
emotionally, it's been challenging, and I've just been trying to take care of myself. Just be in a moment with my kids too, because sometimes like I could be on my phone halfway paying attention to them.
right,
But sometimes like I do have to recognize like, okay, put your phone down, all these other distractions, just be in the moment like with my kids, because that also brings joy to me. And like that's self-care for me too, just being in the moment with them, like
it's
being
really,
interested in like whatever they are interested in. If it's something on the wall or something on the floor or some random toy, just engaging with them like in that way, being in their little world.
their little world is so beautiful.
Yes,
And it's
it
just
is.
innocent and pure.
Yes, innocent and very pure. It's just, yeah, watching them experience life like through their eyes.
Yeah. And you and their papa made them. Isn't that a trip?
Yes, that is a trip. And can I also add that right when I first found out I got pregnant, Collins like touched my stomach and was just like, "Oh, you're gonna have twins." And I looked at him, I was like, "What are you talking about? Like, you're crazy."
That was a gentleman that was so happy to be a father. Oh my goodness.
Yes,
OMG.
yes.
Collins was like, I'm having babies.
Uh-huh.
He was
So happy.
down to be a father.
Yes, yes, yes. He was down. He was very supportive throughout
Very
this
much so.
whole process.
Very much so.
Yeah, yeah,
Yeah, he is a
yeah.
definite blessing. He was such a pleasure. I remember when he was playing wonderful music during your
Yeah,
labor
jazz.
and
And we started dancing.
trying to help you to calm down, and you guys were dancing. Oh, it was so sweet.
Hmm.
It was so precious.
Yeah,
You know,
yeah.
just his whole attitude was like, okay, I could see that he wasn't pleased with Dr. Man either, but his
Right.
attitude was like, I'm gonna be on my wife. I'm gonna take care of my wife. And
Mm-hmm.
that beautiful moment when y'all were dancing, it was
Yeah.
so sweet.
Thank you.
Another thing I remember from your labor was
Mm-hmm.
when you were told you told the nurse you did not like that doctor, you didn't want him to look your babies, and she was like, "Oh well, he's the only one on right now that could possibly deliver a breech," and so we were all disappointed. And you said to her, "When is he off duty?
Mm-hmm.
Leave." And she said like what 7 o'clock or whatever, right?
Mm-hmm.
And whose labor totally slowed down?
Mine. It did.
And whose labor picked up at 7:10?
When the new doctor shift started. Yeah, that's so crazy. I
That
didn't
was
even
you.
realize that,
Oh,
but
girl.
that was my body saying, no, 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 no.
That was your strong will right there. You were like, oh no, that you are not delivering my baby.
Yeah.
And
No,
he
no,
did.
I was very adamant about it. I was like, I don't want him in the room. I have to deliver these babies by myself.
You asked that question and then your labor slowed down. I was there
Wow.
like, mm-hmm.
I didn't even connect those two. Wow. But that is like what
That
happened.
is what happened.
That is what happened. Yep.
And it picked up all by itself.
Mm-hmm.
7:10. It picked back up.
Yeah. Wow.
That's great. I was so
Yeah.
happy for you.
Right. Yeah. Wow.
Ooh, Lord,
That's
honey.
funny.
Well, I really want to thank you for giving me your time in your busy household for
Yes.
your precious babies.
Oh yeah, yeah. No
And
problem.
thank you for giving this blessing for other clients and giving permission for other folks to hear your story. You have so much
Yeah.
strength to share. You
Thank
know
you.
how you did get you got advocacy through your doulas for sure, but you advocated hard for yourself.
Mm-hmm.
You know,
Yeah.
and then the follow
Thank you.
through of writing the letters and then dealing with 2 rounds of kaiserishness, etc.
Mm-hmm.
But you still did that. You didn't,
Thank
some
you.
folks would have given up and you didn't give up.
Thank
And you
you.
got your vaginal birth to perfectly healthy baby.
Yes, thank you. And thank you just for all of your support throughout this whole process.
Oh,
Like
I'm
you were
here for your
there.
family forever. I'm here forever. Ask me questions anytime.
Thank you.
Yeah.
Thank you. We appreciate you.
Yeah. Hopefully next year you can have a party and invite people and I can come bring a gift.
Yeah, yeah, yeah. Hopefully. You know what? Actually, this year worked out. I mean, I didn't expect for this to happen and I didn't really want this to happen, but we ended up having like a little Zoom party, or it wasn't like a party for them, just like everybody just logged in and said happy birthday and sang happy birthday. But
That's
the
so
baby
sweet.
started to actually throw a fit. And so right after the happy birthday, we were just able to just log off and say, okay, we got to go, which worked
Goodbye.
out perfectly, because had it been a party for a 1-year-old, we would have had to leave our own party, you know, just to calm them
Exactly.
down.
Calm them down.
Yeah.
Yeah, that first birthday party is really for the family anyway.
Yeah.
At 2 and on is when they're going to start to really get what their birthday is.
Mm-hmm.
It'll be on and cracking.
Yeah. Yeah. That's when they started getting to like, wait a minute, we get one of these every year.
And people give us stuff.
Uh-huh. Can't wait till the next year come around. Wait till my birthday come around next year.
Oh, well,
Yeah.
my sweetheart, I'm going to let you go.
Okay.
And I want
Thank
to
you.
thank you again for letting us make this recording.
Of
And
course.
again, my absolute devotion forever. Anything you and your family needs,
Thank
that
you.
you do listen here for you and love you.
Thank you. Thank you.
And
Appreciate it.
spread the good news to other pregnant women to get that support for themselves.
Yes. And to share our stories too. Like we
Me
need to
too. You
share our
hear us.
stories more, because there's so much resiliency in that, and just just everything. We need to talk about our stories more.
We do. We need to have more than like Grey's Anatomy to teach us about childbirth, because
Right.
every birth on that show is a dramatic mess. You ever watch that?
Yeah. And it don't even be like that in real life half the
It,
time.
it really is not like that most of the time. But on Grey's Anatomy, everyone's screaming, yelling, and is whatever. So everybody's
Right.
people call me after a Grey's Anatomy birth. I'm like, so sorry, remind me about how birth is supposed to be. And I'm like, not like on Grey's Anatomy.
Right. Yeah.
That show
You
off.
can create your own birth experience.
It is a made-up TV show, people,
Exactly.
by
Yeah.
people who probably haven't had any kids. But
Yep.
anyway, so I want to
Yeah.
wish you the best rest of your day.
Thanks.
Peace
You
and
too.
prosperity on your home.
Thank you. You too.
Yeah.
Stay well, stay safe. We love you. And we'll definitely be in touch. I'll be sending you more pictures.
Oh, hey, that makes my day.
Yeah.
But pictures come just when I need them. I'm feeling all funky. I was feeling all funky. And you
Yeah.
sent me the birthday pictures, and I was like, oh, look at those beautiful little feet.
Aw. Aw.
All right, sweetie, give my love to Collins,
Okay, I will.
and you take really good care.
Thanks. And you too.
Bye
Bye.
bye.